السلام عليكم ورحمة الله وبركاته. اليوم ندرس موضوع جدا مهم وهو drugs act on hypertension or antihypertensives. First of all, we have to see what we mean by blood pressure. Normal blood pressure and systolic blood pressure not exceed 120 and diastolic below 80. While in case of hypertension will occur when systolic blood pressure exceed 130 millimeter mercury or diastolic pressure exceeds 80 millimeter mercury on at least 2 occasions. يعني نقيسها مرتين على الأقل في أقل تقدير نشيكه للضغط الدم. Hypertension results from increased peripheral vascular resistance, which lead to increased arterial resistance and reduced capacitance of venous system. In most cases, the cause of the increased vascular tone is unknown. Chronic hypertension, either systolic or diastolic, can lead to many complications like stroke or cardiovascular or cerebrovascular accident, congestive heart failure, myocardial infarction and renal damage. The incidence of morbidity and mortality is significantly decreased when hypertension is diagnosed early and is properly treated. ولذلك فحص ضغط الدم بصورة دورية للأشخاص اللي عندهم positive family history واللي فوق 40 سنة يكون ضروري جدا. وبالنسبة للشخص اللي عنده ارتفاع في ضغط الدم يجب عليه الالتزام بأخذ العلاج حتى لا تصير هاي الكومبليكيشنز. This table shows the criteria for hypertension in adults. مثل ما تشوفون العمود الأول هو classification. عندنا normal blood pressure when systolic less than 120 and diastolic less than 80. Second, what we call it pre-hypertension. لما systolic blood pressure equal to 120 to 139 or diastolic from 80 to 89. Then hypertension stage 1 when blood pressure or systolic blood pressure equal to 140 up to 159 or diastolic is 90 to 99 millimeter mercury. While hypertension stage 2 when systolic blood pressure equal or more than 160 millimeter mercury. Etiology of hypertension. Although hypertension may occur secondary to other disease processes, more than 90% of patients have essential hypertension, a disorder of unknown origin affecting the blood pressure regulating mechanisms. كثير من الأشخاص المصابين بضغط الدم اللي يظهر عليهم بعد 40 سنة احنا نسميه essential hypertension. A family history of hypertension increases the likelihood that individual will develop hypertensive disease. كذلك اللي عنده بالعائلة مالته وراثة للإصابة بضغط الدم راح يكون استعداده أكثر لكذلك الإصابة بضغط الدم. Regarding essential hypertension, it occurs among middle-aged males more than middle-aged females, and the prevalence increases with age and obesity. Age and obesity نسميها predisposing factors. Environmental factors such as stressful lifestyle, high dietary intake of sodium, and smoking further predispose an individual to the occurrence of mechanisms for controlling blood pressure. Arterial blood pressure is regulated within a narrow range to provide adequate perfusion of tissues without causing damage to the vascular system, particularly the arterial intima, which we call it endothelium. This equation shows that arterial blood pressure equal to cardiac output multiplied by peripheral resistance. So, cardiac output, depending on many factors like heart rate, contractility of the heart muscle, filling pressure, and filling pressure equal to or depending on blood volume and venous tone, while peripheral resistance depending on arterial volume. So any antihypertensive agents decrease blood pressure will act through these mechanisms. Baroreceptors and the sympathetic nervous system. Baroreflexes involving the sympathetic venous system are responsible for the rapid moment-to-moment regulation of blood pressure. A fall in blood pressure causes pressure-sensitive neurons, which is baroreceptors, in the aortic arch of the carotid sinuses to send fewer impulses to the cardiovascular centers in the spinal cord. This prompts a reflex response of increased sympathetic and decreased parasympathetic output to the heart and vasculature, resulting in vasoconstriction and increased cardiac output. These changes result in a compensatory rise in blood pressure. طبعا تعرفون on the heart muscle تأثير معاكس للsympathetic والparasympathetic on heart rate and vessels. The second mechanism called renin-angiotensin-aldosterone system, the kidney provides for the long-term control of blood pressure by altering the blood volume. Baroreceptors in the kidney respond to reduced arterial pressure and to sympathetic stimulation of beta adrenoceptors by releasing the enzyme renin. Low sodium intake and greater sodium loss also increase renin release. So, what does renin do? This peptidase, renin, converts angiotensinogen to angiotensin 1, which is converted in turn to angiotensin 2 in the presence of angiotensin converting enzyme, ACE. Angiotensin 2 is the body's most potent circulating vasoconstrictor. It constricts both arterial and veins, causing an increase in blood pressure. Angiotensin 2 exerts the preferential vasoconstrictal action on the efferent arterioles of the renal glomerulus, increasing glomerular filtration. Furthermore, angiotensin 2 stimulates aldosterone secretion, leading to increased renal sodium reabsorption and increased blood volume, which contribute to further increase in blood pressure. These effects of angiotensin 2 are mediated by stimulation of angiotensin 2-81 receptor. As you see in this diagram, decrease in blood pressure lead to increased sympathetic activity. This will increase the activation of beta-1 adrenoceptors on the heart and lead to increased cardiac output. Then lead to increased activation of alpha-1 adrenoceptor on smooth muscles, lead to vasoconstriction and increased peripheral resistance. And all these lead to increased blood pressure. On the other hand, decreased in blood pressure lead to decreased renal blood flow. This will stimulate the release of renin. And renin, as you see, that is peptidase that convert angiotensinogen to angiotensin 1 and lead to release of angiotensin 2, which is more vasoconstrictor agent. Also lead to increased aldosterone, and this will lead to increased sodium and water retention that increase the blood volume and lead to increased cardiac output and also increased blood pressure. Now we can see the treatment strategies. The goal of antihypertensive therapy is to reduce cardiovascular and renal morbidity and mortality. The relationship between blood pressure and the risk of the cardiovascular event is continuous, and thus lowering of even moderately elevated blood pressure significantly reduces cardiovascular diseases. So that a newly added classification, which is pre-hypertension, which recognizes this relationship and emphasizes the need for decreasing the blood pressure in the general population by education and adoption of blood pressure lowering behaviors. Current recommendations are to initiate therapy with thiazide diuretics unless there are compelling reasons to employ other drug classes. If blood pressure is inadequately controlled with thiazide, a second drug is added with the selection based on minimizing the adverse effects of the combined regimen. A beta blocker is usually added if the initial drug was a diuretic, or a diuretic is usually added if the first drug was beta blocker. A vasodilator can be added as a third step for those patients who still fail to respond. However, angiotensin II converting enzyme inhibitors and angiotensin II receptor blockers, calcium channel blockers, can also be used to initiate therapy. Individualized care. طبعا مثل ما تعرفون اكو individual variation بالإضافة إلى ذلك اكو certain another diseases with hypertension, ولذلك there must be individualized. So certain subset of hypertensive population respond better to one class of drug than they do to another. مثل ايش؟ مثلا for example calcium channel blocker, angiotensin converting enzyme inhibitors and diuretics are favored after treatment of hypertension in the elderly, whereas beta blockers and alpha antagonists are less well tolerated. Hypertension may coexist with other diseases that can be aggravated by some of the antihypertensive drugs. In such cases, it is important to match antihypertensive drug to the particular patient. في هذا الجدول راح نشوف drugs classes indicated in treating hypertension with other disease. مثلا عندنا concomitant disease مثلا high risk angina pectoris، فمن الأفضل نستعمل هنا beta blocker or calcium channel blocker. For example diabetes with hypertension، من الأفضل نستعمل diuretics or ACE inhibitors or even angiotensin receptor blockers. In case of recurrent stroke with hypertension، من الأفضل نستعمل ACE inhibitors In case of heart failure with hypertension نستعمل diuretics, beta blocker, ACE inhibitors or angiotensin receptor blockers and so on. Basic pharmacology of antihypertensive agents, we can see many groups like diuretics. طبعا انتوا اخذتوا هذه المحاضرة مستقلة. كذلك sympathoplegic agents. هاي sympathoplegic تشمل drugs that lower blood pressure by action on the central nervous system, drugs that act by inhibiting the transmission through autonomic ganglia, and drugs that act by reducing the release of norepinephrine from the sympathetic nerve endings, also drugs that blocks postsynaptic adrenoceptors. The third group is the direct vasodilators, which reduces pressure by relaxing vascular smooth muscle, and the fourth, agents that block production or action of angiotensin, وإن شاء الله نأخذها هذه يعني. Summary of antihypertensive drugs. First, diuretics, beta blockers, ACE inhibitors, angiotensin II receptor antagonists, renin inhibitors, calcium channel blockers, alpha blockers, vasodilators or direct vasodilators, and centrally acting sympathoplegic drugs. And last is the adrenergic neuron blocking agents. Summary of antihypertensive drugs. First, diuretics, beta blockers, ACE inhibitors, angiotensin II. This list shows the many types of diuretics: amiloride, bumetanide, chlorthalidone, ethacronic acid, furosemide, indapamide, spironolactone, torezamide, and so on. Diuretics lower blood pressure primarily by depleting body sodium. Angiotensin converter. Diuretics lower blood pressure primarily by depleting body sodium stores. Diuretics can be used as a first-line drug therapy for hypertension unless there are compelling reasons to choose another agent. فهي طبعا يعني first choice إلا إذا كان أكو سبب آخر. Low dose diuretic is safe, inexpensive, and effective in preventing stroke, MI, and congestive heart failure, all of which can cause mortality. Recent data suggests that diuretics are superior to beta blocker for treating hypertension in older adults. طبعا هاي يعني نتائج الدراسات الكثيرة انه الدايوريتكس هي افضل ومفضلة جدا على البيتا بلوكرز في علاج ارتفاع ضغط الدم عند الاشخاص عند كبار السن. Diuretics are effective in lowering blood pressure by 10 to 15 millimeter mercury in most patients, and diuretics alone often provide adequate treatment for mild to or moderate essential hypertension. In case of severe hypertension, diuretics are used in combination with sympathoplegic and vasodilator drugs to control the tendency toward sodium retention caused by these agents. This slide shows that thiazide diuretics are appropriate for most patients with mild or moderate hypertension and normal renal and cardiac function, such as hydrochlorothiazide. It lowers blood pressure initially by increasing sodium and water excretion. This causes the decrease in extracellular volume, resulting in decrease in cardiac output and renal blood flow. With long-term treatment, plasma volume approaches a normal value, but peripheral resistance decreases. Potassium-sparing diuretics are often used in combined to these diuretics. The more powerful diuretics, we call it loop diuretics, are necessary in severe hypertension like bumetanide and furosemide. Potassium-sparing diuretics are useful both to avoid excessive potassium depletion, particularly in patients taking digitalis, and to enhance the natriuretic effect of other diuretics.